Hi, I'm Dr. Robert Perkins. I'm here today to talk about the anti-medication sort of perspective that I have. And many people think that I should be wearing like a tinfoil hat when I start to go on about this. I start to communicate about this sort of anti-medication perspective that I carry, specifically in the area of mental health as well as male sexual dysfunction. And the perspective that I have is based on my own lived experiences, my many, many years of clinical research as a sexologist, as well as observations of successful non-pharmaceutical based treatments. So I have a very complex relationship when it comes to medication. Adverse effects of prescribed medications have affected many members of my family. As well as my own physical and mental well-being over the course of life. So that's where this passion stems from when it comes to being anti-medication. Since the time I was about 14 or 15 years old, I was chronically diagnosed every year with a respiratory issue. It was usually about every 12 months. It was usually between the period of December to, say, January. And each year, I would routinely suffer from either bronchitis or pneumonia. Each year, I would see my family doctor and I would be prescribed some form of antibiotic, usually penicillin based, usually ampicillin, amoxicillin, as well as a sort of codeine-based cough syrup. But each year, I would rarely get the exact same medication as I had had the year before. My doctor would generally rotate them. And as I had the codeine-based cough syrup and the antibiotics, it certainly made it easier to endure those symptoms that I was suffering from at the time. But I was always amazed at how I always got sick every single year at this same period of time. As I got older, pneumonia seemed to be the dominant of those two things that I would suffer from, and as opposed to getting bronchitis. And with that, the dosage of my antibiotics began to increase over the years, starting at 250 milligrams to 500 milligrams to 750 milligrams up to 1,000 milligrams. So it was as if my body was starting to become immune to this drug, and the dosage that worked fine the year before didn't seem to work in the same way. And I was also knocked off my feet when I got pneumonia. So I would be in bed, even under these medications, for about a week to 3 weeks. Now, when I was injured in the military and I almost had my hand severed completely off my arm, the pain was intense. And when I was admitted to the hospital, I was on a heavy morphine drip. But after about the first week or two, that morphine seemed to stop working. And they started trying different pain medications, Percocet, all kinds of different things. Now, I would get different reactions from these drugs. Percocet, when I went on that, it was like I was having a psychedelic experience where there were other drugs when they tried them. They sedated me. They just knocked me right out. And I can't remember how many different medications they tried until they got it right. But it was kind of like they were playing pin the tail on the donkey. And when I was finally discharged from the hospital, and I'd had this conversation with my doctor, he had told me for some reason my body seemed to have built up this immunity to the effectiveness of morphine. And, that was never an issue until the first time I went to the dentist to have oral surgery after that incident. And the dentist administered the normal amount of freezing that I'd always had. And he went to begin that surgery, and it didn't work. I flew out of the chair, the tools, the tray went everywhere. He applied another needle, didn't work, applied another needle. And that particular day, it took about 7 shots of freezing for that medication to work for him to be able to do the surgery. And to this day, it takes about 4 to 5 freezing shots in order for me to have oral surgery. Now, I also smoked for many years of my life. I started smoking when I was about 14 years old, and in the early 2000s, I wanted to quit smoking. And I had many unsuccessful attempts to quit smoking, so I went to my doctor to get some advice, and he prescribed me Zyban, which I thought was just a drug for quitting smoking. And after I started taking it, I did lose the desire to smoke. However, I also lost the desire to do pretty much everything else. I was like a zombie. I felt nothing. And little did I know at the time that Zyban was just another name for a drug called Wellbutrin, which is an antidepressant drug. And the funny thing is that I was not depressed before I took the medication, but I became depressed while I was using the medication and for a short period of time after I stopped using. So there are many drugs that are used for other than the purpose that they were initially discovered for, and Zyban or Wellbutrin was one of these drugs. But when you look at what some of the common side effects are of this drug, symptoms of anxiety, agitation, tendinitis, those are common side effects. More serious side effects: chest pain, fainting, fast pounding heartbeat, irregular heartbeat, mental mood changes, muscle aches, ringing in the ears, severe headaches, uncontrolled movements, unusual weight loss or gain. Rare side effects: muscle pain, tenderness, weakness. Serious side effects: eye pain, swelling, redness, widened pupils, vision changes. Possible allergic reactions: rash, itching, swelling, severe dizziness, trouble breathing. And then we look at also dry mouth, trouble sleeping, dizziness, may raise your blood pressure, may cause seizures. It's crazy. So here I was just looking for something to aid me in deterring a habit that was very, very bad. And I got this drug that I had put a lot of faith in. I was excited. This was going to help me accomplish a goal that was going to contribute to better wellness for my physical body. But when I look at what that drug did to me, all of the various side effects, it was a very difficult sort of situation in my life. I had a high fever, had a lack of energy, difficulty breathing, and so on. I made my annual pilgrimage to my doctor and came out with a bag full of medication to take. Now, my wife had studied at a period of time in her life traditional Chinese medicine, and she was very anti-medication, although I didn't really know that at the time. But when we got home from the doctor, she began to review the medications that I came home with and started telling me how bad they were. I'm like to her, I will likely die if I don't take this medication because my bouts of pneumonia were pretty severe. I had been rushed to the hospital a couple times in the past by ambulance. It was a big deal. I had a family history. I had my grandfather that suffered from pneumonia who had also been hospitalized many times. So I was unaware that a very close relative of hers was actually a pharmacist. And she had spent a lot of time in researching pharmacology and understanding how many of these drugs affected people. And she convinced me not to take the drugs and to trust her, although I was not all for that. But she convinced me, and begrudgingly, I agreed to do that. And what generally took me a week to 3 weeks to recover from, I recovered from in under a week. It was a rough week. It was a rough week of aches, of pains, of coughing, of fever. And really, the treatments that I had were hot and cold. I constantly was able to change my body temperature through hot and cold showers. And after about 5 days, I resumed my optimal wellness. I got quicker than I had ever experienced in my life on medications. And you know what? 2009, from that day forward, I never got pneumonia again. After I recovered from that, I detoxed myself of medications. I took no medication of any kind with the exception of Advil for a period of 9 years. From 2009 right up till about 2018, 2019, when I had an incident in Hollywood where I was rushed to Cedars-Sinai. I had to have emergency surgery. When I was in for surgery, my body had not had any kind of pharmaceutical medication in it for over 9 years. And during that period of time, I was extremely healthy. I didn't get sick. When I had my surgery, They gave me over 13 different types of drugs during my surgery. And for about the period of about a year, 2 years after that, I wasn't as healthy as I was prior to that. I didn't get pneumonia ever again, but I just generally didn't feel as healthy as I did before. It was almost as if my body was now clean, it was cleansed, and all of a sudden, this toxin was in it, and it was fighting to get it out. Am I saying that there's no place for medication? Absolutely not. Thank goodness for medication. I can't even begin to imagine the pain that I would have endured had I not had the morphine and other medications when I had my accident and I was hospitalized, and likewise the pain that I experienced in my surgery. But I recognize that in prescribing medication, even in a medicalized sense, by a physician or a surgeon, is not 100% exact science. There is science to it, but every individual is different. So in that measure, it's not an exact science. But when it comes to psychiatric health, and when it comes to prescribing medications in the mental health community, this is dangerous, because I'll tell you one thing is that, 85 to 90% of all psychiatric medications that are prescribed by general practitioner doctors that do not have psychiatric training. That's a red flag. And when we look at all of the side effects in knowing that individuals that are suffering from depression, from anxiety, from post-traumatic stress disorder, we're finding in these studies that the antidepressant medications are not only coming with this wide range of side effects, but there's 6 times more suicidal ideation in an individual that's on an antidepressant. That a majority of these individuals, when they stop taking the antidepressants, go through withdrawal symptoms that are comparable to going off heroin. That after they stop taking this, they're suffering from sexual dysfunction such as erectile dysfunction or delayed ejaculatory difficulty, all of these sort of terrible things.